Good evening and welcome to Solutionary TV. I am your host, Dr. Tatiana. And in keeping with solutions-based and independent media, information, and education as the platform that we are eager to address something that has been all over the news, that has been a really relevant topic, and that is getting back into a place of health, vitality, and addiction-free. We have a crisis for painkillers and opioids in this country. We have a lot of individuals that are struggling trying to get the right treatment when they have been involved in alcoholism. And we know that there has been a circular type of door in wellness and other institutions and bringing people back to their wholeness. So it is our very special privilege to have Dr. Jeff McNairy with us tonight. And let me tell you a bit about his expertise, because he is really in a cutting edge position to be delivering and bringing others into their wholeness with where he works and his application. Dr. Jeff McNairy has been working in the healthcare field for over 25 years. He's been devotedly entrenched in a variety of medical environments and has witnessed the struggle that individuals have experienced when actually trying to heal in the current Western system of healthcare that very often addresses treating symptoms rather than diligently seeking the cause. Through Dr. McNairy's intense experience with the most desperate patient populations, such as those experiencing addiction, as we've discussed, acute mental health, and trauma, he has come to the affirmation that the only real healing must come from within. As the Chief Medical Officer of Rythmia Life Advancement Center that is located in Guanacaste, Costa Rica, Dr. Jeff has committed himself to bridging ancient modalities, plant medicine, cleansing, mindfulness, and more with Western psychology to heal and empower their guests. Welcome, Dr. Jeff. It is really a privilege to have you with us tonight.
Thank you. It's great to be with you. It's an amazing show and some great topics you guys discuss. I'm privileged. It's an honor for me to be here. Thank you.
Oh, well, it always goes both ways. I mean, we can't have a show that's based in solutions if there are not really those that are out in the field innovating, being visionary, and thinking outside the picture. And we do know that there are handicaps and maybe limitations, somewhat of a myopic view occasionally in Western medicine when we're dealing with a holistic view of healing, whether we are dealing with addiction or with mental health or trauma. And I know that you've got a huge amount of experience with this. There is some limits that you've been able to overcome by going out and working with those at Rythmia and the expansive view that they have on that holistic model of healing. Can you talk to that a little bit? I know that the limits are something that you have shared much on your Facebook Live events, and there's really been a lot of wealth of knowledge that's been shared there. But for our viewers' sake, let's talk about the difference between the Western model that you at one point were completely codependent on working within and how that's expanded with what you have going on at Rythmia.
Great. So, it's when I was being trained as a psychologist, and I also have a master's in public health from UCLA, and I, worked, like you said, in all these different health agencies, whether it's an inpatient psychiatric hospital. I was the director of a really well-known rehab in Malibu. I ran different divisions of the UCLA Med Center and medical care and mostly OBGYN departments and Department of Health of Hawaii. So what I saw in these environments is that there's all this external change that they tell people that you have to do. So for example, like addiction, they always say like, okay, you got to change your friends, you have to change your environment, you have to get outside therapy, you have to take meds. There's a lot of stuff you got to do on the outside to change the inside, but we all know that doesn't work. The statistics on addiction recovery are really low, and it's super expensive. It's really dangerous. People are very high risk that have addictions. As this one example, this one patient population, we don't have years and years and years to work with people. We need to fix people now. People need change now. So the whole Western model is more about like external solutions, and it's about, well, if everything on the outside is different for me, then somehow I'll just get on board individually and internally, and I'll just change. But that's just not what I saw. And maybe that's something for people to have moderate or mild situations. But as you mentioned, the opiate crisis we're facing in the U.S. and in the world, it requires something quicker and something to happen now for somebody. So my Western view that I was involved in for so long, it just kept hitting like dead ends, and like you said, a revolving door of people inpatient and coming back again. And it wasn't going anywhere, and people are just really frustrated. They're just tired of it,
Yeah.
and people, they don't know what to do. That's the thing. Like, people just don't know, families will say, okay, well, we don't know what to do with this family member. Just put them in a rehab. Or we don't know what's wrong with this person. They're always suicidal. Put them in a psych hospital, or go to therapy, and just, endless things. So, I don't blame people for not knowing, because it's just the Western model doesn't teach us what we really need to do to change.
Right, right. And I realize too, when we don't know and the model isn't working, very often there's this hopefulness that, well, if we try it again, maybe it's about, aligned timing. Maybe someone wasn't fully committed. But as you're looking at some of the trauma, when we consider the concept, the most simplistic human pursuit of pleasure versus trying to avoid pain, when there's been trauma and there's a wound and we haven't really gotten to the cause of it, and we're also dealing with the fact that we're trying to avoid the chaos of the pain in our lives and we're seeking greater pleasure, it's easy to get caught up in a cycle with no other options to go to our core, to have that real soulful, dark night of the soul that can be seen in the light of day, and have that wound looked at and maybe loved and integrated. Not part of the Western model very often. And I do not take anything away from the attempts towards AA, for instance, but I know that very often there are affirmations that make statements along the line of, I am this, making a very affirmative statement. I am an alcoholic. I am a drug addict. I have no power over my disease. When we make these affirmative statements, would you say that actually only furthers that wound, Dr. Jeff? Can you help us understand some of the languaging around what empowers an individual out of addiction?
Correct. Yeah, I love that. That is just the wildest stuff ever that they talk about in 12-step. And again, like I said, like, I'm not against any method that helps people. My grandfather was a big 12-step guy, and it saved his life. So I have people that I've referred to 12-step, but I completely agree 1,000%. The way that we feel about ourselves and our own self-talk and these affirmations, like you said, that the 12-step model has, are extremely negative, and in my opinion, very destructive in certain ways. Mm-hmm. So it's much more positive to say, like, I am powerful as opposed to powerless, and I don't have character flaws. I just understand the full picture of me, and I'm choosing the good and the light and the happy and the loving, right? So it's crazy to me, sort of, that people will just look in the mirror and go, I'm a drug addict, I'm an alcoholic, I'm a screwed up person, so therefore I'm going to have a great day now. It doesn't go that way.
No, it's counterproductive. And anyone that's been involved in psychology, even, in the Western model, all the way down to the type of work that I do as a holistic life coach, knows the cellular intelligence that makes up this field that we would call our physiology, whether you want to look at it holistically as body, mind, and spirit. If you just want to talk about the intelligence of our cellular intelligence, it's listening. What we say creates chemical responses in the body. Thoughts, have a tendency to trigger emotional responses that create biochemical responses, neurochemical responses. And so if we want to heal in a permanent and meaningful way, obviously that really needs to be considered. And this is part of the work that you're doing out at Rythmia. Tell our viewers how you kind of did a graduation from a more strict protocol to embracing a more holistic model. And then we'll go into a bit of the fabulous work you're doing at Rythmia.
Great. So when I was the director of the rehab in Malibu, it was a super high-end place. And I was hoping when I was there that I would have a lot of different modalities that I could use to help all the patients. And it was true. There was a ton of different therapeutic models that we could use, because it was so expensive that I thought, okay, well, the way I'm going to justify managing this ridiculously expensive place is that I'm going to be able to actually heal people with these modalities. And we had 35 different types of therapies going on in the week, all kinds of body work and marriage and family counseling and individual therapy and just a bunch of stuff. Mm-hmm. And, what was happening is the same statistical outcomes as any rehab, whether it was a free rehab, Salvation Army on Skid Row, same statistics, which is 12% stay sober. Wow. After doing inpatient, so a year later, only 12 are sober. So that's just like, I was so upset about that. And I had a patient show up, and his name was Jerry Powell, and he was this amazing dude. He had this crazy history. He had a ton of drug and alcohol addiction issues, and him and I instantly connected because we kind of had a similar background of like a rough upbringing in a rough neighborhoods that we grew up in, and we started working together. And I started testing all these different modalities on him. None of them worked really long term, and on a whim, he decided that he found out through some friends that there's this plant medicine that they offered in Costa Rica. He was going to go check it out. So he said, "Hey, I'm going to go down there. What do you think?" I'm like, "Well, I've heard a little bit about plant medicine. I don't know a ton. I've seen some documentaries on it, but I just thought, like, we've been working together 4 or 5 years. Try anything now, because I don't know what to do." Right.
Exactly.
So, yeah, I was kind of, I was out of ideas. I didn't know what to do. So Jerry went down to Costa Rica. He did plant medicine, 2 sessions of it, just 2 nights. And he came back a totally different guy.
Yeah.
He was connected and plugged into himself. And it was hard for me to believe. So he said, "Come down here and you do it yourself with me." So I did. I flew down 2 weeks later to Costa Rica. I'd never done any sort of stuff like that. Like I was studying for 18 years in school. I didn't have time to be partying and doing all this stuff, so I just thought, like, well, this is a drug, potentially. So whatever, I'll try it. He was so different that I had to see what this was about.
Right.
So I did plant medicine in Costa Rica. And a funny story that Jerry tells is that halfway through the night, I was kind of like sobbing a bit, kind of whimpering. And the shaman came up. He's like, "Hey, man, are you all right?" I said, "No, my license is worthless. It means nothing. This is the real deal. This is what works for me. I'm totally connected to myself now. I worked on so much inner issues. I did inner child work. I worked on trauma that I had from a kid. I did all this breakthrough work in one night, and it just blew me away. It just blew me away."
Right.
So Jerry and I wanted to have a place that was safe, medically licensed, and approachable for people that would probably never do what we did, because we went into this really rustic, kind of jungle area that wasn't what most people are going to do, and so we felt that this modality of plant medicine for people for psychological change and emotional change and spiritual and also medical change would be more palatable for people in an environment that they felt safe in and that was licensed medically. So that's kind of like how that happened, how the transition went from the Western sort of framework I was in into more of a traditional plant medicine environment.
What a phenomenal and devoted practitioner you are, though, to take yourself down there and outside of ego and having to prove oneself. And like you said, very hard won 18 plus years of education and training and applying yourself and your expertise and being willing to try something this radical and this different. We have a lot of open-minded viewers, but not everyone really understands plant medicine as opposed to drugs, because, you made the statement that wasn't your path. You didn't go off to college to party. There is a growing body of curiosity in our populace, in our society, around really reinvestigating sacred plant medicine, psychedelics. Just to name a few, marijuana in the right setting and intention, and with conditions that you understand dose, psilocybin mushrooms, ayahuasca. There's so many, San Pedro, and in the really wonderfully and beautifully put together documentary, Reality of Truth, they talk about this story. Jerry does a gorgeous job with Zappy to be able to help everyone understand the evolutionary journey of really respecting that we do have receptors. We have, synaptic and neural receptors in our brain that align with these medicines, with the DMT and some of the other neurochemicals that open up our awareness, that expand our ability to really perceive ourselves at a deeper level, that kind of bring down the veil and help us see ourselves, our shadow, our beauty, our godliness and all, if you want to use some of these terms. So wouldn't you say that if we really understood the medicine as you had that experience in the jungle, it gives you a certain access to yourself that we have a tendency to be somewhat blind to in the Western world?
Absolutely. The Western world, as we know, has evolved medically into this sort of position where they're kind of stuck. And I think most people are becoming aware that pharmaceuticals are not the answer, and that shutting down your own self-awareness is not helpful. And it's manifesting in so many ways, politically in the country, in the U.S., and also for all these diseases. Every family I know is touched by an addiction or a horrible sort of physical trauma that's going on with people. So and they're not getting the answers they want or need from their doctors and their psychologists. So I think what's happening is there's this shift where people are like, I want to get back kind of down back to basics, and I want to learn what are these ancient cultures so aware of. Where does this knowledge come from that these shaman have and that these ancient cultures have? Because when you go to these villages in Peru, Colombia, if you go to Africa and you go to Gabon, Africa, there isn't what we would label as like mental illness or emotional disease. There's not all these conditions, and maybe it's the way they frame it differently. Maybe there is schizophrenia in Gabon, but it's not viewed as an illness. It's viewed as a person being in touch with themselves in a different way, and actually being a channel for spiritual stuff. So the way they view people is just so different, and the way they treat illnesses is really different with these plant medicines. And the thing that's interesting about it is, because I look at all the biochemical side of these plant medicines, a lot of the pharmaceuticals, of course, are from these original molecular structures.
Right.
So it's not like it's some sort of bizarre, weird thing that is, just about partying and having fun and this and that. Because I'll tell you what, this plant medicine, I wouldn't consider it fun. I would consider it.
Mother is going to cleanse you, isn't she?
Yeah, she is. She is. It's not something that you're going to get addicted to. It's not. It's really not the way this works. So, it's so interesting to see these people come to our facility. None of them have tried plant medicine before. It's like 90% of our guests, it's their first time, and they're all nervous. They're all a little worried. They're kind of like how I was. Like, I've never done psychedelics or whatever, but they've reached the end of their rope with therapy and meds and all these different Western beliefs that are hindering them. So it's a beautiful thing to see, the people are waking up in this area.
Right. And I know that Rythmia takes great caution to also make sure, you're on site there as, the clinical doctor overseeing who's coming with various conditions, what medications are they taking. There's so much sensitivity to your intake process, isn't there, Dr. Jeff?
Absolutely. So when people call to book their stay, they meet on the phone with one of our intake staff who have a list of questions. They email them a ton of information. We talk about heart conditions. You have a history of brain traumas or certain sort of seizure disorders. We talk about all the meds that people are on, and we give them protocols to taper. They have to work with their physician, back home to do that. But there's all these medical guidelines and protocols because we're licensed by 3 different medical boards in Costa Rica through the Ministry of Health. So there's all these requirements to keep things safe. So the horror stories that if people look on the internet, they see all this crazy stuff going on with ayahuasca or other plant medicines. That's not the case at Rythmia because we're run in such a tight way with all these protocols. So it's really, really safe for people. It's a very good environment.
Yeah, I'm sure that if anyone wanted to dig and try to find something contraindicative about it, they could find about those that go off into the jungle in Peru, with a shaman that isn't licensed to do anything more than what he was raised probably by his lineage to do, and not being aware of all of the issues that someone may come down with. There's going to be, the potential for either a misuse or a miscalculation of how much someone can take because that wouldn't be their background. Really, it sounds like what you're doing there at Rythmia is taking this whole approach, a body, mind, and spirit, because there appears to be a very strong leaning towards if we're going to heal trauma, if we're going to get to the root of addiction, sometimes, we need to recognize that there's a deep, deep wound that needs to be alleviated. And being in connection with a thinner veil and a deeper perspective of self, you can really get to some of that causality, can't you, Dr. Jeff, with these particular patients or guests when they come to visit you?
Definitely. And the issue in the West is that in order to do that kind of deep work, it takes a really long time. And most people are not going inpatient to deal with trauma. They're outpatient. So, they're seeing a therapist, or they're going to a group, or they're in some sort of, program that's an intensive outpatient. And the problem with that is you can't have a safe, contained environment to really do the deep work. Because when you unveil all this stuff, that's historical, it's hard. It's hard work. And you need to have an environment that is safe and that has a clinical staff that are aware of what your needs are. So what we're doing at Rythmia is we're providing that safe environment, and people can basically, I call it, they can unravel a bit and, have those emotional moments or those emotional half days where, they're really upset and confused about, like, what happened to them and why are they, feeling so upset about their life. We have a ton of staff to help provide a safe container for them.
Right. I was really impressed too, and I'm going to tell our viewers for the first time, I will actually be attending Rythmia with an intimate group coming up in the first week of February. I'm really looking forward to it. This is not my first experience with plant medicine. I actually believe that it is another outlet to greater awareness and contacting a fuller and more integrated version of ourselves, tapping into our intuition, which is latent in a lot of us, but is always looking and seeking to be a greater skill set. And so I have a huge, tremendous respect for it. But looking at the great care that Rythmia does in the intake process, we're not just looking at addiction to, chemicals, alcohol, drugs. There is also the understanding that abstinence from intimacy is going to kind of cleanse and redirect your energy in your vehicle. Being attentive to get off that caffeine high for those of us that are on roller coasters with our coffee, coming up and heading down, cleaning up the diet a little bit to really prime the body to be able to purge what it needs to purge. Could you speak to that a little bit more, Dr. Jeff? I think that those that just think, hey, I'm going to go and hang out at a gorgeous resort and, I'm going to do this cool plant medicine with people, don't really understand the comprehensiveness of care and involvement that goes into preparing a guest.
Yeah, and no, that's a great point. I love that, because if you're not prepared emotionally or physically to go into this, you're really going to be wasting your time. So you're not going to have the insight that you're seeking,
Right.
So a big part of preparing, like you said, is the abstinence part from sex, just to stay focused with your energy. Also, the diet is super important. Now people often say, well, because we have guests that call and come the next day. So they're a little worried sometimes, like, well, I haven't been able to eat this clean, healthy way that you guys talk about, which is called a dieta. It's an ancient traditional way of eating. It's really kind of basic and simple and usually vegan based.
Right.
And so people can still do the plant medicine if they haven't been preparing. But what I see when people book in advance enough time, a couple months, let's say, or 4 weeks in advance, they have plenty of time to get on track with all these, sort of strategies on how to stay focused. And what I've noticed is if I'm preparing my mind and my body for a plant medicine experience, and I'm going to go eat somewhere, if I'm thinking to myself, okay, what I'm putting into my body is really important because I have a goal in about a month to do something that's going to be really profound.
Mm-hmm.
What happens is it keeps even that meal keeps me focused on what my objectives are. So it's like you said, a mind, body, spirit approach to getting prepared. Mm-hmm. And if I'm out just not caring about it, drinking alcohol and having a pizza and just whatever, I'm not really thinking about my experience. I'm not preparing my mind. So it's very key to do that sort of pathway leading up to the plant medicine.
Well, let's talk a little bit about the plant medicine. My understanding is that it is dealing, again, with more of the shamanic practices that you would find in South America, Costa Rica. Can you address how you graduate your guests through introduction, the plant medicine a little bit so that they understand how that shifts takes place and the ease of getting familiar with it and how it has an effect on you personally?
Yeah. So what happens in a week stay at Rythmia is that we have 4 plant medicine ceremonies, and the very first night, which is a Monday night, we call it a gentle introduction to plant medicine, and we give people a small dose because we want to see how they feel. We don't want them to feel overwhelmed because, if people are terrified the first night they get there because they had too much medicine, then that's not a good way for them to build confidence for the week. So after they drink one smaller size dose, After about 45 minutes or an hour, we offer them more. And if they're not sure about it, our shaman staff who are there are very in tune themselves with the guests, and they can offer more or suggest more. But really, it comes down to the person, and they can have another drink of the medicine, and they can have 3 and sometimes 4 drinks in an evening to just get themselves transitioned into the deepness of their experience.
Mm-hmm. And what do you typically find? I'm assuming that you're present for some of these, their group inductions to the plant medicine, right? And so you're there kind of watching over those that are being introduced to it. What do you kind of find is the first real breakthrough awareness for those that are new to the plant medicine and are experiencing it maybe the first night or the second night in terms of a shift of awareness or expansiveness? Talk to that a little bit, Dr. Jeff.
Sure. Well, what I noticed right off the bat, and I'm on call for every ceremony every night. So I'm always up there in the evenings and I'm checking on the guests as well as our whole medical team is available. And knock on wood, we've never had any sort of medical issues, but sometimes there's an emotional issue, so I'm available. Mm-hmm. But the first thing I notice for the guests, usually night one, is that they shed off all of this guilt that they've accumulated in their life for various reasons. Like, oh, I wasn't a good parent, and my kids now, they resent me, or they feel, I don't feel good as a parent, or I'm not a good spouse, or I've made the wrong decisions in my life, and now I'm in a career I don't like. And what happens is, especially night one, is that guilt goes away, and people really get to, it's incredible. And people get to say, like, you know what, I'm a good person. I have flaws that are reasonable because everybody does.
Right.
And I'm happy with who I am. And what we call that sort of transition that occurs is, we have what is it called? Like a mantra, and it says,
sure,
show me who I've become.
Mm-hmm.
And that's like our first sort of intention that we suggest that people look at night one, is show me who I've become. And then looking at the whole self, you get to see, like, wow, like I'm an amazing person, and I also have flaws, and that's okay. And I'm having peace with that now. And so that really prepares them for the rest of the week.
I love the way that you pointed out that one of the first layers to come off is maybe a layer that we have protected on ourselves from ourselves. We literally shield ourselves from the whole person that we are through guilt, through disassociation. And if the very first night you can reintegrate and look at your shadow and look at your failures and look at the moments where you've stumbled in relationships and embrace yourself with that kind of self-love, realizing there's enough redeeming qualities here, I can work with this. I forgive me first. That alone would actually probably answer to at least half the addiction problems we have in the Western world, is misunderstanding and self-loathing and disassociation, right?
Absolutely.
So,
it's incredible. Night one, profound. I mean, it's so cool. Like, we have these 4 ceremonies, but the very first one they do is just incredible. And they get so much out of it, So
then it graduates over the course of the week that they're there, and there are 3 more plant ceremonies that I'm assuming have a slightly different tenure to them, maybe a different shamanic practice, and grow in intensity a little bit.
Exactly. Yeah. And our next sort of intention that we have the guests work on after they've seen who they've become, the next one is to reunite with their soul, and then to get a new heart. So a big part of, like, Jerry's sort of plant medicine experience was basically those things. And during the plant medicine experience that him and I both have had, it showed that these are sort of like universal truths to help us connect with ourselves and have success and be happy and connect with others. So the next sort of deeper part is to, reunite with your soul, get to know yourself truly. The physical self and the spiritual or emotional self become united, and you have like a contract that you make with yourself where you're gonna, validate the spiritual side that you have. And some people view that as, more of the emotional side, that you're gonna be plugged into that. And then after that, that you're gonna get a new heart, meaning that you're gonna be pure intended and healthy and happy and clear. And that's basically what happens throughout the week, with the medicine going deeper emotionally. And there's also very loving parts to it. We have one night where we have all of our female shaman, And that's my favorite night, because it's just full of this maternal love that matches the plant medicine. So it's done in a way that's very thought out, with these intentions and these themes that our program offers to the guests.
Let's talk a little bit about what that plant medicine is actually doing from a psychological standpoint. I mean, obviously it's a neurochemical effect, and we're talking about DMT, dimethyltryptamine, correct?
Correct.
Okay.
Correct.
From your perspective, and this is personal for you, obviously it was a big shift for you, Dr. Jeff, when you had your personal experience, and obviously there was such a powerful effect. Clearly, you're questioning all of the years of your training and the various protocols and modalities that you've done to just push that back and actually and put it all into place, to ask yourself, did you have everything that you needed to really be able to have an impact on the patients that you've worked with, and was this important to integrate? Clearly it was. But from a personal testimony and your own experience with it, what do you see is actually happening when that DMT is sustainably accessible in the brain, and the liver isn't creating the enzymatic process that's inhibiting it, as we know that it has a tendency to do? A lot of our viewers are familiar with psychedelics, and they understand the importance of plant medicine tribally and shamanically, and that it is a natural state for our bodies to create DMT ourselves. Other mammals do. It exists out in nature and in life, but we have an enzyme in our body that has a tendency to counteract or inhibit it. And what the ayahuasca does is it allows a sustained state of that DMT. So just share with them emotionally what's happening, what's taking place that's creating such an expansive view for your guests.
Well, the way I describe it is, in our amygdala part of the brain, where a lot of our emotional trauma is stored, there's a lot of neuron pathways that are kind of ingrained into the way we think and respond to things that come in our life. So if I'm not aware, obviously it's in my subconscious part of my brain. If I'm not aware that let's say I was scared by a dog at age 5, I was terrified of a pit bull. And so for survival, I learned as a 5-year-old that dogs are scary. I need to stay away because they're going to hurt me and I need to survive. So what happens is that was a very scary event. So as I move on in my life, and I'm not 5 anymore, I'm in my 30s and 40s and 50s, I'm still afraid of dogs, and it's super weird because I see everybody else loves dogs, and I want to like dogs, and they're cute, but I'm just afraid of them. So what happens when you take the plant medicine is your amygdala begins to communicate with your prefrontal cortex, which is where our consciousness, as you know, is stored. It's where our rational sort of thinking is involved. And you get to link up with those two parts of the brain in a way that's like really cool and profound, because you say like, wait a minute, that makes perfect sense. At age 5, I was scared of a dog. I don't need to be afraid of dogs now. I'm a grown adult. I can avoid scary dogs, but most of them are cool. And now I'm building a new neuron pathway that means dogs are loving and dogs are cool and dogs are friendly. And I can do basically synaptic plasticity is occurring, where I'm shifting a different neuron and create a new neuron pathway that the DMT allows for. So it enhances awareness, but it does so in a way that's neurochemical based on brain chemistry and the way that we store thoughts that are traumatic.
So, this is so important for our viewers. You hit so many things. One is there's just been so much more awareness socially now. It's becoming a lot more academic and mainstream. Neuroplasticity, what does that mean? We are constantly reiterating and reinforcing different connections in the brain based on ruminative thoughts and behaviors and belief systems. And we can change those at any time. We can create access in the brain, neural activity, synaptic response, and like you said, get connection from the amygdala where there might be trauma, and get greater clarity and communication to prefrontal cortex, pineal gland, get it out of calcification, fluoride, and a lot of things in our diet. And a lot of these pharmaceutical drugs have a tendency to create some more disassociation in the brain, doesn't it, Dr. Jeff? That
Absolutely.
Just reinforces that disconnectedness that we're walking around with very often in the Western world.
And I love how modern science in the Western world believes that the pineal gland is like almost an irrelevant structure. I just love how when they say that, because it's a great way to just make everybody think that, hey, you know what? Don't worry about that part of the brain. It's not relevant for you. It's just crazy, right? It's just crazy, because a lot of our connection comes from that area of the brain. A lot of our self-awareness does. And, it was crazy because I thought at some point in my career before plant medicine, I thought like, hey, you know what? I'm a psychologist. I've done a ton of work on myself. You know, these mandatory hours of therapy were required to get my doctorate. I've worked with so many people. I've cleared out my own issues. And I felt like, yeah, you know, I'm pretty well adjusted. I'm cool. But no, that was not the case. That was not the case. What I had done growing up in a rough area of Los Angeles, I had always had a persona that I was a tough guy, and I was a scary big. I'm a pretty big dude. I'm 220 pounds. I'm 6'2", and I fight mixed martial arts. I'm a surfer. I've always been this big guy,
Right.
and I would intimidate people. I wasn't a mean guy, but that was like the way I portrayed myself to the world. That I'm tough, and I'm just this strong dude. But what happened was when I did plant medicine, I realized I went back to my 5-year-old Jeff in my neighborhood, and I was able to talk to me at that age, and it was crystal clear. And I just learned that I was just really scared in the neighborhood I was in. I was terrified. It was a dangerous area. There's a lot of bad stuff happening on the streets. I had a loving family, great family, but my neighborhood was just horrible. And I realized that persona of this big tough guy, scary dude, was just to protect a scared little kid.
Right.
And that is not who I really am at my core. I'm a nice guy. I'm loving. I'm actually a teddy bear. And so I was able, it's pretty funny, but I was able to shift that in one night. And what happens is, you know, people before they do plant medicine, when they think that they're going to change, they get a little nervous. They think like, oh, am I still going to be successful in my job? Am I still going to be able to be the same person that I am? And I just tell them, yes, absolutely. You're going to be stronger in the things you're doing. You're going to be happier in the things you're doing. You're going to have new awareness. And so it's actually a really, really profound experience.
You know, I've heard really very experienced gurus in plant medicine. Terrence McKenna is known for his work. His brother Dennis does a lot with that. Just watching some things with Kalindi and psilocybin mushrooms, and they all come at it, they approach it with tremendous respect. The understanding is these plants are here to help us deepen our understanding to ourselves, and you don't always know what part of you it's going to show you. I doubt you went digging deeply for the 5-year-old version. It kind of rose to meet you and say, hey, I'm something that needs to be healed. There's been some disassociation here, and I'm looking for wholeness. And can you bring this fraction of me forward so that I can come into wholeness and be seen and embraced? And that's really the beauty of it. But it does take some courage to be able to be willing to sit in such a reverent and sacred space that is provided at Rythmia, trusting that you're going to be in good company and held, and allow whatever needs to come up so that we can really heal in a meaningful way. Isn't that correct?
Absolutely. Absolutely. I couldn't agree more. You said it perfectly. And what happens, through that process is freedom and clarity. And it's things that, people really, really deep down want, but just don't have the tools or the methodology on how to achieve it. So, I left, this weekend, the guests for the week, they checked out, and I did all their intakes the week before. And all of them were scared and reluctant and hesitant and weren't sure. And they said, well, I hope this works. And I just look them straight in the eye and I tell them, it's going to work. You'll see. And when they checked out Saturday and Sunday, they're crying because they're so happy about what's changed. They have that look of freshness in their face, and they're just awake. It's a beautiful thing to see every week after week after week at Rythmia.
Let's talk about the integrative process. I really have appreciated watching all the Facebook Live. Jerry Powell is doing the, what guest is going to share their miracle. I got my miracle. And you can watch the testimonies of those that have gone through the process and how they felt before they made the choice, and some of the graduation that went through, awarenesses that came up, change in diet, view of life, future paths, whatever that happens to be, and a sense of returning as a more whole version of themselves. You have, of course, a state-of-the-art facility. There are a clear diet that is provided. There's fresh organic fruit and vegetables and juices and teas, as I understand. There's opportunities for massage and volcanic mud bath. There, you can tell that I've read the brochure over and over and over again, right,
I love
Jeff?
it. Yeah,
I can't
awesome.
wait. There's even, for those of us that are interested in cleaning from the inside out, the hydrocolonic with the Dead Sea salts, and then there's wonderful swimming and sauna, and there's just really, it's an attention to detail on every level. And Reverend Michael Beckwith has created a program just for your guests there. How do you integrate his program? I'm a big follower of his and Agape International, and he was good enough to actually endorse one of my books, and I think tremendously highly of him. How do you merge his coaching into the psychology and the protocols that you're providing there, so that our guests have or our viewers have an opportunity to see what that opportunity would look like as a guest as well?
So almost every day we have what's called The Answer Is You, and that is what Michael Beckwith, it's a curriculum that he has. I'm sure you're familiar with it. It's a curriculum that focuses on, internal change, just like we're talking about, and all the things that you can do as a person to wake up and move forward in life. So we have his class taught by some of his practitioners almost every day at Rythmia. That's one of our core base classes. We also have classes that Jerry will teach and classes that I sometimes will teach. And we have group integration every day. And there's just a ton of opportunity to receive information from people and that are our staff there who are experts in this. And we have transformational breath work that also goes on. It's incredible.
When we have a real problem with that, don't we, in the West, Jeff? We've got so many people that have been holding their breath in traditional education and boardrooms. We've got people that don't even know how to breathe correctly anymore, and tight solar plexus and rigidity in the body. And so that's a huge piece too, isn't it? Is getting them back into really being conscious of their bodies and breathing with a lot more harmony.
Correct. It's huge. And what's incredible is that people don't understand until they try this method that we have, that this is something they can do at home anytime. And you're in control of it. And it's a great way to plug in. It's beautiful. And, it's something that we're really digging deeper into at Rythmia, because there's some people that aren't medically qualified to do the plant medicine for various reasons. And they really get benefit out of the breathwork classes.
Okay. So now, how would you describe, if you were just to have a quick, conversation with someone in passing, the power of the work that you're doing as you started and you left, your education at UCLA and your practice in Malibu? As you've incorporated all of these pieces, Dr. Jeff, how would you reframe the type of transformation that you're involved in now?
I would say internal change is the key to your own personal happiness, and it is 100% possible. You can heal your body, you can heal your mind. It's totally up to you. We'll show you how to do it, and we'll hold your hand as we guide you through this process that is deeply personal for you.
That sounds fabulous. I don't know anyone that would not get really excited about the opportunity to take such a holistic approach into kind of reclaiming themselves, and then taking that holistic model that has been reintegrated and be able to kind of redream their life on every level. Do you feel that 1 week is sufficient for most people? I know there's a 2-week process as well. How does that deepen for those that choose to stay a little bit longer, Dr. Jeff?
Most people that we have stay the 1 week, and we find that to be perfect. Some people, have been through some things really hard recently, and they choose to stay 2, and that's also really great. And the more the better in a way if it's together for 2 weeks. But most of our guests do the 1 week program, and that is sufficient to really get the goals they have.
Well, there's so much training, and there's been such a layer to it. I know that when I'm going to be attending with some friends of mine. Greg Braden is going to be there. I recently went and saw him at a conference in London. He's a powerful forward thinker, and it appears that what Rythmia is offering is not only while you're working on full integration of yourself and harmonization of your health and clarity of purpose, you've got these additional speakers and guests that are world-renowned, amazing authors, speakers, change makers that are reminding us how to take the best parts of ourselves that we're integrating and actually go back into the world as a change maker, as to really see an integrated and connected vision for our future as a population. We really do want to be part of the solutions across the board, don't we, Dr. Jeff?
Correct. And it brings a context to kind of the work we're doing. Because, some people can kind of go through this process and then feel at the end, they're like, oh, no, I have to go, back home where my family and my people I work with and my neighborhood is the same. And I feel out of place now. I think so much differently. But what these guest speakers do is they help bring a global sort of unity to this way of thinking and this shift, and people feel more a part of a movement that's really healthy and also very individual to the person, and it helps them stay plugged in to the goals they had at Rythmia. So the guest speakers are amazing, and it just helps kind of solidify the week that they were there.
Yeah. I have not found any other retreat that has as comprehensive and as complete a curriculum and an application for wholeness, health, and reclamation, and then really taking all of the beauty of that integration to the next level like Rythmia offers. I was thinking, what would Rythmia be if it didn't have the plant medicine? And it comes with so much. I mean, obviously we talked about diet and we talked about the medical care and we talked about the therapeutics and the spa and the breath work and the yoga and the coaching. But can you imagine where it might have stopped short if there had not been this sacred adherence and acceptance of the plant medicine? Do you just see that as being an absolute essential aspect of it?
I think that's a great question because our program is definitely, the peak of our program is the plant medicine. But what we're finding out through our data analysis of the outcome measures of all the guests that fill out a self-response exit survey is that the breathwork classes are actually just as profound as the plant medicine. So we're looking in the future to have certain weeks in the year that are only breathwork based.
Wow.
And we're going to test. Yeah, it's going to be really cool. So because we're seeing very similar results from that. Mm-hmm. But this is because we're the only place really doing it this way. And we're kind of breaking new ground in a sense, even though all these modalities obviously exist, all over the place. We've brought them all into one location, and we're kind of like, as we move forward, we're analyzing everything to make sure that it's the most effective method that's out there. Mm-hmm. And currently we have about 93% of our guests that report that they got their miracle, which means, they had this transformation occur for them. But right. We're not going to settle with 93%. We want 100%. So we're looking at all these things such as breath work to maybe enhance that and make more, maybe have more classes of that. So but indeed, the plant medicine is definitely the cornerstone for us. Mm-hmm. That creates the quickest shift that we've seen. So, if people can't do the plant medicine, we're going to have something for them that's going to be just as profound because we'll have the breath work 7 days, the whole week for the week that we choose in the future here.
Well, I really want to get a lot of our viewers taking a look at Rythmia's website and taking a look at the wonderful documentary that was done that I think is really convicting for anyone to consider looking at something this expansive, and also taking a look at your Facebook page because you've got these great recordings, that have been uploaded to YouTube that give not only Jerry the opportunity to talk about the work that he's doing. You've got some fabulous interviews, but in particular, the I Got My Miracle, from former guests. I think that people can really resonate with that. Do you mind sharing one of your favorite I Got My Miracle stories that you could share with our viewers tonight? And then we're going to make sure that everyone knows exactly where to find you, your work, and also Rythmia. But share one of your favorites. We'd love to hear it.
Well, I had a patient come to Rythmia recently that she was basically totally rejected by her family. She had a lot of very chaotic ways of operating in her life. She was extremely smart, had a great education, but she was struggled with substance abuse, and she felt misunderstood by the world. Basically, her relationships were really bad, and she just felt alone and isolated, but had a ton of energy to try to like do the right thing and to be happy, but she just couldn't quite do it. She didn't know what was wrong. She tried all these self-help things. She went to tons of lectures, you know, where she was from in Florida, and just constantly seeking a way to kind of like resolve her family issues and all this personal stuff she was having. So when she came to Rythmia, she was really scared because she felt the pressure that she had put on herself, like almost like this is her last resort in a way. Like she felt that vibe for herself. And I just told her, I said, just relax, you know, just everything's going to be okay. Just take a deep breath. Now we're here to help support this process for you. Just trust the process. And she went through all the plant medicine ceremonies. She did all the breath work and all the modalities we have. And she came to my office the day before she was going to leave. It was just sobbing, you know, because she just couldn't believe that so much had changed for her, the way she viewed herself. Her family immediately noticed that she was, you know, not attacking them, and they felt less attacking of her, and she was less defensive. And not only was she shifting in this week, but her family was, because they could feel the change. And this girl is incredible and has done a ton of work at Rythmia. And she got her miracle because she wanted it so bad. And, you know, we knew it was going to happen. It's so exciting at the beginning of the week to meet with these guests because we know it's going to happen, but, you know, they're not so sure yet. So we have the luxury of looking at thousands of patients we've worked with that have done this. And, you know, they're just the one person, they're a little nervous and scared, you know. So it was incredible that she got her miracle. And she contacts me, you know, every week. She sends me an email or a text. She's like, I'm doing great. Things are amazing. And she's moving forward. It's just so cool to see. It's so cool to see, you know.
You could really get high on your work, couldn't you, Dr. Jeff, just knowing?
Oh, yeah.
I mean, when you get to see that kind of a change in someone's life, and to be able to say to them when they first come with some trepidation or maybe lack of, you know, assurance, or gosh, this is my last ditch effort, I don't know what I'm going to do, to bring them back to a place of spiritually having a sense of greater expansiveness, of connection with themselves, being integrated, connection with a sense of maybe, you know, what the all is all about, what source is all about, what we're all here sharing in this experience together, whatever that perception of the veil is. That's powerful. Getting the neurochemicals in the brain balanced. I know that when we get people off these unnecessary meds or these recreational drugs, we get brain resets too, right? We get to really kind of clear out the cobwebs and the disconnect between various aspects of the brain, as you mentioned, the amygdala, and getting access to pineal gland and prefrontal cortex, and resetting the brain. And then we give the body the opportunity to breathe deep, to move through oxygenating the blood, the vascular system, and clearing out digestion and eliminative organs and liver. I mean, it's such a comprehensive potential shift that you're offering them. To be able to send them on their way with greater access to themselves has got to be deeply, deeply empowering. So I just want to thank you for sharing this. You've got to let our people know, where do they find your work personally and what you're doing at Rythmia. Do some props for the work that you're doing. Let them know.
Cool. So if, you know, the best way to find out more about Rythmia, just go to our website at rythmia.com. It's spelled RYTHMIA.com. And we have a Facebook page also that's just under Rythmia. And there's a lot, like you said, there's a lot of videos there, a lot of informational stuff that will, you know, we address all kinds of different stuff. Like today, I'm going to do a Facebook Live later tonight, talk about attachment disorder and how that can be resolved through our program. You know, and a lot of these things that everybody's facing, whether it's personality disorders, addictions, anxiety, depression, trauma, you know, it's some of these things people say are uncurable and you can't change. I've seen people with personality disorders get past them. That's the most incredible thing I've ever seen. So look for our Facebook and our internet webpage. It's the best way to find out more about Rythmia.
Yeah, beautiful. Thank you for sharing that. And it has been such a pleasure having you tonight. We apologize to any of our viewers because we started a little late, but it was absolutely worth it working through all of that crazy technology to get you on tonight. Take a look at their Facebook page. Take a look at Dr. Jeff's Facebook Live. He's got some amazing content that is really addressing everything to do with mental health and wellness, and how truly curable, it may be a word, but let's have more hope and faith that there is a deeper process than what we've been told. And remember that together we are the solution. Thank you.
are tuned to the Nissan Communications Network. If you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section at nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by Telestream's Wirecast software, StreamingGear.com, Carolina Apparel, and DeltaForce.net.